Hello everyone, my name is Dr. Umair and today we are going to start anatomy, which is an important subject of the MBBS. In anatomy we study about the morphology, shape or structure of the different organs and parts of the human body. Today we are starting the anatomy of the human body from the skeleton system of the body. Skeleton of the human body provides support and structure shape of the overall body and also help in the movement of the body. And the skeleton, first of all we have to know about that which type of tissues are used to make the skeleton, like skeleton is made up of which type of tissues. As we know that, and we previously studied in the FSC or A level, that there are four types of tissues in our human body. Which are they? They are connective tissue, epithelium tissue, nervous tissue and muscular tissue. And the our skeleton system, bones are and cartilage are made up of which type of tissues? Connective tissues. Let's write it on our notepad. Skeleton, skeleton of body is made of which type of tissues? Connective tissues. Okay, let's start our skeleton of the human body. And the skeleton of the body has different parts. Let's divide it into different parts. The first one is our cranium, the head or skull. We can say that skull, overall skull, cranium, and also there is a thorax, trunk, which is also known as trunk, upper limb and lower limb. And also these parts are subdivided into different parts according to their function and structure. And as we know, as we are studying about anatomy, so let's divide all these parts according to their structures, morphology. Let's start today with the vertebral column of our body. Vertebral column, vertebral column is also known as spinal column. Why? Because the spinal cord, which start from our brain, ends at the at our back, moves all the way through our vertebral column from along the center of the vertebral column. When we study about the anatomy of the vertebral column, you can understand about it what I am saying now. The vertebral column is further divided into five parts. Five parts means it is divided into sections. The first one is cervical and second one is thorax. Let's write it. Cervical, thorax, and third one is lumbar. Fourth one sacral, and the last fifth one is coccyx, which is also known as coccygeal spine. but in short form it is known as coccyx. Okay, and like why the spinal cord is divided into further five sections. They are divided into further sections according to their morphology, as we know that we are studying about the anatomy of the human body. So these are divided according to the morphology. Why the cervical region is the region which forms the area which covers the area of the neck, and these vertebra are five in number, seven in number, seven. While the thoracic region is the region where there is a thorax, the whole trunk of the body where the vital organs are present. Like it also support the rib cage by the sternum and also the vertebral column, covering all the vital organs, and these vertebra are 12 in number. And the lumbar region is below the thoracic region, and this region is consists of five bones, sacral and coccyx. These vertebra are present at the hip joint, uh, below over the spinal cord. These are five in number. Sacral and coccyx are four in number, which are fused. The coccyx four vertebra are fused. Okay, let's see all of them via diagram. As you are looking at the diagram, there are five regions. The red one is cervical, which is covering the neck region of the body. This one. Okay, and these are ribs, and the thoracic region covering the rib area, trunk area, where the majority vital organs are present. And the lumbar region is the region where the kidneys, it is supporting the kidneys. Here the kidneys are present at the backside, like just consecutive to the lumbar vertebra. And there is the last two segments, sacrum and coccyx. You can see the sacrum also fused, and the coccyx are also fused. These vertebrae are fused with each other, while the first three regions have the individual vertebra that are not directly fused to each other. Okay, we have studied about the five segments of the vertebral column, but there is a question that why we need to like create segments of the vertebral column. We can create the whole vertebral column and study it like one by one vertebra, but why we need to further make segment of the vertebral column? The answer of this question is that these five types of vertebra are different from each other by their shape, and hence by their shape they are also performing different functions. Generally their function is to hold the upper trunk of the body, but in a different way. How? Let's see. The upper neck region supports the head and also provide the movement of a head in as we say no or yes. How this movement of left and up and down is managed? It is managed by the first two vertebra of the cervical region, and these are different from other vertebra in the shape, and hence they are also have different functions. Okay, and then next, the thoracic region. The thoracic vertebra, why are these are different from the cervical, lumbar, sacral and coccyx? How? Because the ribs are attached to these vertebra, and they provide the ribs a space and also support for them to hold the whole trunk. And then lumbar, they provide the protection to the kidney, and also they are bigger in size. Why they are bigger in size? Because they have to hold the whole upper trunk, and in this way, and in the last sacrum coccyx, they are fused and they are joined with the hip bone, and with the hip bone they provide support to the upper trunk, and also lower trunk, they form joint. In this way, every segment of vertebra have different function and structure according to their need in our body. Okay, cervical are 7 in number, so they are named as C1 to C7. In the same way, thoracic are T1 to T12. Okay, then next lumbar are 5 in number, L1 to L5. In the same way, sacral and coccyx, S1 to S5. Okay, these are also fused, and in the last coccyx, C1 to C4. Coccyx normally are not divided into four because the coccyx are fused. Like in some cases, sacral is not directly fused, but the coccyx is always fused with each other. That's why coccyx is considered as a whole bone, like in such a way that four bones are fused with each other and forming a whole bone. That's why coccyx is considered as one bone.